Did you know that millions of people are misdiagnosed with high blood pressure every year, simply because of common measurement errors? Even worse, your doctor's office might be making these mistakes too, leading to unnecessary medications, stress, and incorrect health advice. We're exposing the 10 biggest blood pressure blunders, some so subtle that even medical professionals overlook them. By the end, you'll know exactly how to measure your blood pressure correctly, avoid false readings, and take control of your cardiovascular health. If you've ever doubted your blood pressure numbers, this guide is for you. Let's dive in. Mistake number 1. Wearing the cuff over clothing. Why it's a problem: many people and even some clinics place the blood pressure cuff over a sleeve, whether it's a thin shirt, sweater, or lab coat. This seemingly harmless habit artificially increases readings by 10 to 20 millimeters of mercury, which is enough to push a normal result into the hypertension range. The science behind it: clothing adds extra compression, forcing the cuff to work harder to detect arterial pulsations. This leads to overinflated readings, especially with thicker fabrics. The fix: always use bare skin, roll up your sleeve, or wear short sleeves. If you must keep clothing on, ensure it's thin and tight-fitting, like a compression sleeve. Avoid bulky sweaters or jackets. They're the worst offenders. Mistake number 2. Arm position matters more than you think. Why it's a problem: your arm must be at heart level during measurement. If it's too low, dangling, or too high, above the heart, gravity distorts blood flow, leading to false high or low readings. The science behind it: blood pressure is a hydrodynamic measurement, meaning fluid dynamics, like gravity, affect it. A dangling arm increases pressure, while an elevated arm decreases it. The fix: rest your arm on a table or armrest, ensuring the cuff is level with your heart. Avoid holding your arm up. Muscle tension can also skew results. In a doctor's office, politely ask to adjust your arm if it's not properly supported. Mistake number 3. The cuff is too tight or too loose. Why it's a problem? A poorly fitted cuff is one of the most common causes of inaccurate readings. Too tight? It overcompresses the artery, giving a false high. Too loose? It fails to detect the pulse, giving a false low. The science behind it: the cuff must apply just enough pressure to temporarily stop blood flow during inflation, and then accurately detect the return of pulsations during deflation. The fix: use the 2-finger rule. After fastening the cuff, you should be able to slide 2 fingers snugly between the cuff and your arm. If you can fit 3 or more fingers, it's too loose. If you can't fit any fingers, it's too tight. Mistake number 4. Skipping the resting phase. Why it's a problem? Blood pressure should be measured at rest, not after rushing to the doctor's office, climbing stairs, or feeling stressed. Yet, many clinics take readings immediately, leading to false highs. The science behind it: physical or emotional stress spikes adrenaline, temporarily raising blood pressure. A true resting measurement requires 5 to 10 minutes of calm sitting. The fix: arrive early to appointments so you can relax. If a nurse rushes to take your BP, politely request 5 minutes of quiet sitting first. At home, sit quietly for 5 minutes before measuring. Mistake number 5. Full bladder, false high reading. Why it's a problem? A full bladder activates the sympathetic nervous system, fight or flight response, increasing blood pressure by 5 to 15 millimeters of mercury. The science behind it: a stretched bladder sends signals to the brain, triggering mild stress responses, similar to how anxiety raises BP. The fix: always empty your bladder before a reading. If you feel the urge during a test, pause and restart after using the restroom. Mistake number 6. Crossing your legs. Why it's a problem? Crossing your legs restricts blood flow, increasing pressure in the arteries and falsely elevating readings by 5 to 10 millimeters of mercury. The science behind it: leg crossing compresses veins, forcing the heart to work harder to circulate blood. The fix: keep both feet flat on the floor. Avoid ankle crossing. It has a similar but smaller effect. Mistake number 7. Caffeine before a reading. Why it's a problem? Coffee, tea, or energy drinks can spike blood pressure by 10 to 40 millimeters of mercury for up to 3 hours after consumption. The science behind it: caffeine constricts blood vessels and stimulates adrenaline, both of which raise blood pressure. The fix: avoid caffeine for at least 3 hours before a reading. If you drink coffee daily, measure BP before your first cup for the most accurate baseline. Mistake number 8. Using the wrong arm. Why it's a problem? The left arm is the standard for blood pressure checks because it's closer to the heart. Using the right arm can lead to 5 to 10 millimeters of mercury differences. The science behind it. Anatomical variations, like artery positioning, mean one arm often reads higher than the other. The fix: always use the left arm unless medically advised otherwise. If you must use the right arm, note the difference and stick to one side for consistency. Mistake number 9, relying on wrist monitors. Why it's a problem. Wrist monitors are convenient but less accurate, often 5 to 10 millimeters of mercury off compared to arm cuffs. The science behind it. Wrist positioning, too high-low, affects readings, and wrist arteries are smaller and harder to detect. The fix: use an arm cuff for medical-grade accuracy. If using a wrist monitor, hold it exactly at heart level during measurement. Mistake number 10, talking during the test. Why it's a problem. Speaking increases blood pressure by 5 to 10 millimeters of mercury due to subtle muscle tension and breathing changes. The science behind it. Even casual conversation activates the sympathetic nervous system, slightly raising pressure. The fix: stay silent during the reading. If a nurse talks to you, politely ask to wait until after the test. Now that you know these 10 critical mistakes, you can avoid false highs-lows and ensure your readings reflect your true cardiovascular health. Key takeaways: bare skin only, no clothing under the cuff. Arm at heart level, no dangling or lifting. Proper cuff fit, 2 fingers snug, not tight or loose. Rest first, 5 to 10 minutes of quiet sitting. Empty bladder, no unnecessary pressure spikes. Feet flat, no leg crossing. Avoid caffeine, at least 3 hours before. Left arm preferred, unless medically necessary. Arm cuff greater than wrist monitor, for accuracy. No talking, silence during measurement. Multiple readings, never rely on one test. What's next? If you've been told you have high blood pressure, but suspect errors, retest using these guidelines.